Hi, my name is Sarah Toaz, and I am the Executive Officer of the Crane Association of New Zealand. And today we are talking all about the most important thing for all of us at the moment, which is mental health. I know it can be a little bit of a difficult topic to talk about, so we are joined today by the incredible Pam Mitchel, who is a registered occupational therapist. And would just like to note right up front that this was facilitated and set up by Hazan. So a big shout out to Philip Aldridge and the team there for setting this up. So Pam, thank you so much for giving us your time today. As I mentioned, Pam is a registered occupational therapist, and she also has a master's degree in business studies. So amongst many other really impressive qualifications, but that and her governance experience means that Pam is really well placed to talk about the health and wellbeing of workers, whilst also understanding the practicalities of running a business. So welcome, Pam, and thank you for being here.
Thank you, Sarah. Pleased to be here.
So did you want to introduce yourself a little further to the association's members?
Okay. So a long time ago, I trained as an occupational therapist, and occupational therapists are keen to work with people to help them do the things they have to do, want to do, and are expected to do. But my real interest in wellbeing and mental health in the workplace arose from being in business with my husband for a number of years. It was a very stressful business. He was a surgeon and had a position in private practice and public practice and worked very long hours. And unfortunately, at a time where we were under a period of stress for a long time, we had 4 children under 7, and we were moving business and moving cities and moving staff and moving houses and lots of things. He was exhausted and was involved in an accident on the way home. That accident killed him. Unfortunately, 2 of our children were in the car as well, and so the accident also took their lives. And so I've developed a very strong interest in just getting people to understand that that's a reality. You don't want to be that person, and you don't want to be the people left behind. It's a tough walk for people who are left behind and have to pick up the pieces. So that's why I'm interested in wellbeing and interested in people understanding that's a reality. That, we've always thought that concrete is tough. People say, I'm tough. We've also thought concrete's tough and concrete breaks over time, and we certainly don't want you to break over time. Where this is a long haul, and we need to make sure that we're looking after ourselves and the people who work in our teams.
Thank you so much for sharing that, because that can't be an easy story. I think the consequences of not looking after yourself or your team can be really serious. And they obviously range. So the idea today isn't to freak people out, but I think it's really important that we understand that consequences can be really serious, and we just all want to go home safe at the end of the day. So the reason that I set this up is because I'm really noticing some things out there in the construction industry. Everybody knows in construction and cranes, we do sort of vary across different industries. We're not just focused on construction, engineering, defence and all sorts of other things. So it's the busiest quarter of the year. Many companies are catching up from delays due to lockdown. Some still working under level 3 conditions. There's pressure from clients and other sources to be vaccinated, which is challenging. And there's stress on staff to get vaccinated. We've further added to that, we've got delays due to the delay in arrival of building materials into the country or from other locations, and that adds to the pressure that's already on site. People are already under pressure from things outside of work, multiple factors, and it's different for everyone. And this is something I learned from the first lockdown, where whilst you may not be worried about getting COVID, it might be terrifying for another person, because they may have an immunocompromised person in their household, or some people may be under extreme stress because they haven't seen close family members in a very long time. Adding to that is vaccinations, health, job security, income, lockdown stress, And it's basically we're adapting to a new way of life, and it's essentially a pressure cooker environment at the moment. So I guess that leads on to my first question, which is it is really unusual and unsettling times for people, but we've got to get on with our day jobs. So what sort of trends are you noticing as an occupational therapist around physical and mental health in the workplace?
The stories that I'm hearing are that there's an increasing amount of sick leave being taken and increasing amount of resignations. So I'm reasonably close to the health sector, so I know lots of people who are working under serious pressure as essential workers, and they're working long hours and they're exhausted, and people are saying, I've had enough, I'm out of here, or they're just not turning up to work. And I'm also hearing that there's a significantly increased demand in using services like employee assistance programs, which is kind of a counselling orientated service.
Yeah, thank you. So we are head down, bum up, just trying to get everything done. How do you tell if perhaps you're not coping?
I think you need to be thinking about what things are changing for you. So are there changes in my behaviour? Am I suddenly going to work late or early? Am I not sleeping? Am I having trouble concentrating? So how's my thinking going? Am I going over and over the same thing all of the time? Do I respond differently? Am I shitty at home, or am I more cross at work and more frustrated and more irritated? And just, so what we're looking for is change. So if someone's been a really easygoing manager or worker normally, and suddenly you're noticing changes in that, then that they are really good signs that all is not well.
And so what are some simple tools or techniques that site managers and companies can do to address the pressure that they themselves are under at the moment?
So I think there's a number of things that you can do. I think one of the most important things to do is to take breaks. So, you know, you're working in a pressure cooker environment, so it's very easy to work 6 days a week. It's very easy to work longer days. We can't sustain that over a long period of time. So we need to be making sure that we're taking breaks and getting back to a more normal way of working. You know, this pressure cooker environment's not going to stop at Christmas time. It's going to carry on. We're going to continue to have difficulties with supply. So, you know, are people having breaks for lunch? Are they having a break later in the day if they're working a long shift? Are people given the capacity to talk about how things are going? You know, are managers checking in and saying how's it going? Doing that check-in on a regular basis. Are you noticing changes in your team's behaviour or response, or the things that we talked about before? So it's about asking and noticing, and boundaries, and thinking about what is the normal routine we had before COVID kicked off. You know, what are the things we did to look after ourselves? Did we go to the gym? Did we walk? Did we run? Did we play sport? And how are we attending to those at the moment? Because often when we're in a pressure cooker environment, those things all go out the window. And for us to do well with our wellbeing in the long term, we need to build those things back in. So if we stop walking, putting the walking back in, you know, people are in sedentary positions, then they need to get out and get some exercise. It's really good for their mental health. Be active, yeah.
Fantastic. So it leads really well into my next question, which is how can companies still manage productivity and performance as well as caring for people's mental health and well-being?
I think it's really good to understand that if we have people who have high levels of well-being, that they're going to be more productive. So that it's about taking the time to talk with our people, making sure that they get the breaks that they need. If we notice that they're not coping, then giving them a day off or an afternoon off, or asking them, you know, saying, I've noticed that and whatever that is the change in behaviour, or the change in mood, or whatever the change is, I've noticed that change. What can I do to help? So, and listening and allowing people to say, actually, I just need an afternoon off. I go home and I have to deal with the kids, and my partner's super stressed, and it's actually getting to me. I'm not sleeping. I just need a day to recover. And just being open to doing that, and knowing that if we look after our team and deal with those sorts of things now, that we're going to still have a team in the long term. What we don't want is people falling over because they're sick. And we know that low levels of wellbeing cause physical sickness as well. So higher rates of heart disease, higher rates of depression, higher rates of cold and flu, because you just become more susceptible because your body's worn out. Yeah.
Mm-hmm. So I guess it's, to be really practical about it, it's just about doing the same sort of stuff that you would do to stay fit physically for work. You would just pay the same attention to the types of things that contribute to you being mentally well for work.
That's absolutely right. And there's always been a stigma about mental illness, but mental health, everybody has mental health, and everybody has a varying level of well-being. So it's really important to pay equal attention both to our physical health and our well-being and mental health. And we know that health impacts our work. So if we're not doing well with our physical health or our mental well-being, that's going to impact our work. And we know that when we have high levels of work and high levels of pressure for a sustained period of time, then that's going to impact our health. So it's about knowing that both are impacted, and that health, of course, impacts our relationships outside work as well as at work.
So just really wanted to acknowledge that our industry, the cranes industry, is very male dominated, and just looking at some sort of obviously you and I being female, we're more willing to have these sort of types of discussion, but it doesn't come as easily for men and others. So what are some practical ways of getting blokes to own up if they're not coping?
I think one of the first things to do is to practice just an ordinary conversation. If we're getting better at just having a normal conversation, hey mate, how's it going? What did you do on the weekend? If we're doing some of that stuff, instead of just doing eyebrows at each other, and we get used to having a bit of a conversation and knowing what's going on for each other because we're mates, then we're a better place to look after each other. And if we're starting to build normal conversations, then we can start saying, hey mate, I've noticed that there's a change in what's going on, listen, and then offer to help. I think also, if people are having their, what are they called, their, I want to call them tools meetings, what are they called, their
toolbox talks, or daily
meetings in the morning, then that's a really good opportunity to say, okay, this is the plan for the day. These are the risks for the day. We know that we've got a big day ahead of us. So how are we going to manage that? Let's have a break at this time. Let's have a break at that time. Let's work around this supplier, or, so it's so that you're building in opportunity to have breaks during the day. That'll actually boost your productivity. And it's really, really important to know that having a break doesn't get in the way of productivity. Having a break actually gives you a moment just to chill so that you go back re-energized and reinvigorated to get on with the job.
Fantastic. And so we'd already sort of talked about and covered how you can tell if someone is perhaps not coping as well as they usually do, sort of the noticeable changes in the way that they are. So how would you talk to someone in that situation if things were sort of seeming to escalate?
Yeah, so you've got to think about where you are and where's an appropriate place to talk to someone. So you want to have a quiet place, a place that's non-threatening, a place that you both feel comfortable. And it's about having a conversation. It's not about you're not counselling someone, you're just concerned about someone. So it's literally just asking, hey, observing, I've noticed that there's a change in what's going on, and then how can I help? And thinking about what support's necessary. So you don't have to be the person who fixes the person you're concerned about. You just need to be the person that's noticing, identifying, listening, and then looking at what support is needed. And the support might be needed outside. The support might be that they just need half an hour. They need to go half an hour earlier in the day so they can do some other stuff and attend to some other stressors in their life. Yeah.
So it's really about partly about understanding what that person needs as an individual, and not sort of trying to apply a standard approach.
No, that's right. So everybody's different, and we're all dealing with COVID, but we're all from different homes with different stresses. I have lots of animals. They're probably my biggest stress. But for other people, they've got they're trying to balance work and kids and worried about jobs and money and income and paying the mortgage, and there's lots of stressors, and that's going to be different for every person. So you can't just give a blanket approach to half a day off will make the difference, because actually if they're worried about the money, that's not going to help. So it might be getting some additional finance advice, and it might be that there's a period of time where they actually need to be at home because the partner has to leave because they're an essential worker. So it's about drilling down and finding out what's exacerbating or making worse the stress for that particular person, and then finding a relevant solution.
Yeah, thank you. And so what about sort of more formal pathways for people to find sort of professional support for their business and their work as related to mental health?
So the Mental Health Foundation has lots of resources online and suggestions about things that you can do or programs that you can run. In terms of individual people, then their GP is probably the key person. So it keeps it local and keeps it in the community. So, and generally people have a reasonably good relationship with their GP. So the GP can also do checks on their health to make sure that there's nothing serious going on there. And if they're concerned about their wellbeing, can recommend further assistance that's local. Yeah. Or people can hit Google and look for themselves, but I would recommend doing it through a trusted person like your GP. And then of course there's the HASANS register as well. So on the HASANS register we have different professional groups from across the health and safety space, including occupational therapists or physios or occupational health nurses. So it's about also using the register as a place to go and get some professional advice.
Great. So we'll put the Mental Health Foundation link and the HASANS register link accompanying this webinar. So mindful of taking up our members' precious time, we'll look to wrap up, and if you could offer 3 key things to our members on how to deal with stress at the current time, what would they be?
Stress is normal, so acknowledge that stress is normal, and actually saying, hand up, oh, I'm feeling stressed is really good, because that enables other people to say, yeah, me too. So acknowledging that people are feeling the pressure at the moment is a really good thing to do. And then you can actually brainstorm. So what's worked before and how are we going to deal with this? What's worked for me might be different from what works for you. So, but what's worked before, and then how can we implement that? And just reviewing it. So if you try something that's worked before and it doesn't actually do the job, then reviewing it and trying something else. And you can do that individually, and you can do that within your teams, and you can do that within your bigger management structure as well. Yeah.
Great, thank you. And any last words of wisdom from you today, Pam?
I just think, just remember, you're not concrete. Concrete also breaks if it's under pressure, and we want you to be well and healthy, and that means looking after your emotional and mental well-being as well as your physical health to last the distance. This is a sprint, it's a marathon.
That's right. So thank you so much for coming here and sharing your wisdom and experience and expertise with us today. Thank you for joining us. Kia ora. And I'd just like to say to all of our Crane Association members and our associated audience, we connect in with a lot of people. Please look after yourself, and just know that it's okay not to be okay, and there's lots of things, practical, simple things that you can do to help. So go well and look after each other. Thank you.
Thank you. Right. End.